Dear colleagues, this is an unedited recording of a Phaco surgery. By this time, thorough wash of the ocular surface has been given with 5% betadine lotion and ringer lactate. Now, main incision is being made at a selected site. You can see that this is an intumescent cataract. We don't know how hard the nucleus is at this stage. One paracentesis incision has been made on the left side of the main incision. Now a big air bubble is being injected into the antechamber. Trypan blue dye is injected underneath this air bubble in sweeping motion so that this dye stains the anterior capsule of the cataractous lens. We can see radial cycle spoke-like pattern in the cataract. This indicates an intumescent cataract. There is convexity of the anterior capsule of the cataract, and I'm going to do two-stage rhexis in this case. First a mini rhexis and then an optimum sized one. Viscoelastic substance has been injected. Now a very small rhexis is made at the anterior pole of the cataractous lens. With the help of this ureter forceps, a small rhexis is made at the anterior pole of the capsule. That's it. Now some cortical lens matter is being aspirated through this small rhexis. I squeeze the lens matter from the periphery towards the center and take it out by aspiration. In this way, I am decreasing the intralenticular pressure, and by this time we can see a brown tinge, and it indicates a hard cataract. So this is not going to be very easy to emulsify the nucleus. I have to use some more ultrasonic energy than usual soft cataracts. Viscoelastic substance is then injected again. Now a Vanna scissor is taken. With the help of this Vanna scissor, I make a small cut at the margin of this mini rhexis, take the ureter forceps again and make an optimum sized rhexis. That's it. The rhexis is made. Now we can go into the eye with the tip of the Phaco handpiece. Some more viscoelastic substance is injected. Hydrodissection is not required because we know that the nucleus is already free from the capsule. In this case we are going to use Oatly Cataracts 3 Phaco machine. I am taking the handpiece, and in this case, since it is a hard cataract, it is about grade 4 nuclear sclerosis. I am going to make a central crater at the anterior pole of the cataractous lens. So here is the tip of the Phaco handpiece. it goes bevel down. Now I start sculpting in Phaco on mode. In Phaco on mode, the power is 80%, vacuum is 110 and flow rate is 25. With bevel down position, we can remove more lens matter with each sculpt. Now after going to certain depth, I make the bevel up, rotating the handpiece with the help of the left hand. Engage the tip at the margin of the crater, hold it firmly and make this first chop. Now I rotate the nucleus 180 degree. Yes, 180 degree. Go to the other side and chop. And this makes the nucleus divided into two halves. Each heminucleus is then further divided into two parts. One part is being emulsified at this moment. At this time the machine is working at Phaco 2 mode. In Phaco 2 mode, the power in this case is 75%, flow rate is 45 ml per minute and vacuum is 450 mm of mercury. That's it. This is the last nuclear fragment. I'm removing the chopper so that posterior capsule goes backward and I can safely emulsify the last fragment. And now I have to remove these cortical fibers and the cells that is sticking to the posterior capsule. We can see that there is a fibrous plaque that is sticking to the posterior capsule. The margin of the plaque is thick, but the central portion of the plaque is not that thick. And this is how I remove the cells sticking to the posterior capsule. I just be on the capsule and make sweeping motions and the cells come off. This cortical cleanup can be done very well with bimanual IA, and I recommend that you stick to the instruments you are most comfortable with. That's it. But some more cells are there at 11 o'clock that is being removed. This is a 23 gauge indirect Simcoe cannula that has been attached to a 10 cc glass syringe. So cortical cleanup has been done. The cells that are sticking to the posterior capsule has been removed. Now viscoelastic substance 2% HPMC has been injected into the capsular bag and in the anterior chamber. In this case, we are going to implant a hydrophobic aspheric intraocular lens. The lens has been placed in the cartridge. This is a 2.2 mm incision compatible cartridge. The end portion is narrower and it engages nicely into the wound, and with 2.8 mm incision it goes almost into the anterior chamber. The leading haptic goes into the capsular bag. The chopper supports the optic and the chopper guides the trailing haptic also to go into the capsular bag. Now a Sinskey hook is taken and the lens is dialed so that the haptics are positioned at a desired meridian. Some viscoelastic substance has been expressed out, depressing the posterior lip. And now I am going to flush out the viscoelastic substance with direct Simcoe cannula as well as bimanual IA. I go behind the eye well and flush the viscoelastic substance out from the capsular bag. This is very important. We usually flush the antechamber and we don't nicely flush the capsular bag, but the capsular bag has to be flushed out very nicely so that we don't put a lot of pressure on the trabecular meshwork. If lot of viscoelastic substance remains in the anterior chamber and in the capsular bag, the next day you may have raised intraocular pressure. You may even see steamy corneal edema. Patient may complain of pain in the night and you will not feel happy. So clean the viscoelastic substance very nicely. At this moment I am using bimanual IA and I am very happy that the viscoelastic substance has been cleaned very nicely. Dear colleagues, we must be very meticulous in our surgeries. We must do a very nice job. Every patient should be looked upon as our very close relative. An old lady like my mother, an old man like my father, a young man like my brother, a young lady like my sister, a very close person of my family. It should be looked upon in this way, and we should do the most beautiful work when it comes to restoring vision after cataract surgery. So this is the final wash. Antechamber is formed with BSS and I come out. Thank you for your eagerness. I hope with dedication, hard work, you can be one of the best phaco surgeons in the world. Thank you once again.